disease. And this presentation will be done in English and Spanish, and the recording will be posted on our YouTube channel if you would like to refer back or share with friends and family. Additionally, at the end of this presentation, there will be a brief optional poll that will pop up onto the screen, so feel free to fill that out if you are willing. And for a slight background on today's presentation, we'll cover the basics of Parkinson's disease, treatment, and brain health 101. The presenters will discuss what movement disorders are, what Parkinson's disease entails, including the signs and symptoms, factors that may cause it, diagnosis and prognosis, as well as current treatment and management options. And finally, and importantly, how to keep our brains healthy. Please feel free to type any of your questions or comments into the chat function below. And the presenters have also indicated that they are willing to accept any questions aloud. So if you want to use the hand raise function or just unmute yourself to ask a question during the presentation, that would be great as well. So without further ado, I'm going to introduce Natalie Hellmers and Abby Andrews, who will be our fantastic presenters today. So first up, we have Natalie Hellmers. Natalie graduated from NYU with her master's in science, and she practices as a nurse practitioner at the Weill Cornell Medicine Parkinson's Disease and Movement Disorder Institute. She provides expert clinical evaluations and treatment for movement disorders, including Parkinson's disease, and she does counseling on the whole patient, reviewing medications, non-motor symptoms, exercise, and diet. She also assists with assessments on Parkinson's disease and Alzheimer's disease research protocols. And next we have Abby Andrew. Abby graduated from Wurzweiler, I don't know if I pronounced that right, School of Social Work with her Master of Social Work and practices as the clinical social worker at the Weill Cornell Medicine Parkinson's Disease and Movement Disorders Institute and the Memory Disorders Program. She assists patients navigate the medical and social service system and provides support and counseling to individuals and their family members coping with a variety of chronic diagnoses. So thank you all. Those are our two presenters, and I will allow them to get started whenever they are. Thank you.
So thank you, Allegra, for this very warm welcome. And to review our learning objectives today, what we will be discussing this morning is understanding the signs and symptoms of Parkinson's disease, the treatment for Parkinson's disease, importance of exercise in both Parkinson's as well as general aging. And we'll talk a little bit about normal aging versus what we see in the symptoms of Parkinson's disease. Move to the next slide, please.
Buenos días todos. Hoy en día vamos a hablar los objetivos de aprendizajes de la enfermedad de Parkinson. Primero vamos a hablar sobre comprender los signos y síntomas de la enfermedad de Parkinson, el tratamiento para la enfermedad de Parkinson, importancia del ejercicio tanto en el Parkinson como en el envejecimiento general y el envejecimiento normal versus la enfermedad de Parkinson.
So what exactly is Parkinson's disease? This condition is a progressive disease of the brain that affects movement. And it predominantly affects dopamine-producing neurons. And these cells begin to malfunction and die. The decrease in dopamine controls the speed of movements and messages from the brain telling the body how and when to move are thus delivered abnormally. The actual cause is unknown, and up until this day, many experts believe that it's a combination of both genetic and environmental factors. About 15 to 24% of people with Parkinson's disease, or PD for short, report having a relative with the disease. And even with a positive family history, the risk of developing Parkinson's disease is actually less than 10%. Next slide.
¿Qué es la enfermedad de Parkinson? Es una enfermedad progresiva del cerebro que afecta el movimiento. Afecta predominantemente a las neuronas productoras de dopamina. La dopamina son las células que comienzan a funcionar mal y mueren. Disminución de la dopamina que controla la velocidad de los movimientos. Los mensajes del cerebro que le dicen al cuerpo cómo y cuándo moverse se transmiten de forma anormal. Se desconoce la causa. Muchos expertos creen que es una combinación de factores genéticos y ambientales. Alrededor del 15-24% de las personas con la enfermedad de Parkinson informan tener un familiar con la enfermedad. Incluso con antecedentes familiares positivos, el riesgo de desarrollar la enfermedad de Parkinson es inferior al 10%.
In the United States, as many as 1 million people live with Parkinson's disease, and this number is going up every year.
En los Estados Unidos, hasta 1 millón de personas viven con Parkinson, y este número ha sido avanzando mucho más.
So how is Parkinson's disease diagnosed? Parkinson's disease is a clinical diagnosis. That means there's no blood test, and it is based off of one's medical history and clinical exam findings. Parkinson's disease looks very different in everyone diagnosed. However, there are 4 main symptoms, and those include slowness, which is termed as bradykinesia, stiffness or rigidity, loss of balance, which is postural instability, and tremor, but very specifically a resting tremor, so a tremor that occurs at rest when the body isn't actually moving. To be diagnosed with Parkinson's disease, the individual must have slowness plus one of the other cardinal symptoms that are listed here. And movement disorder specialists really specialize in the diagnosis and treatment of Parkinson's disease are the suggested providers to see for these symptoms. Next slide.
¿Cómo se diagnostica la enfermedad de Parkinson? La enfermedad de Parkinson es un diagnóstico clínico. Quiere decir, no hay análisis de sangre, se basa en la historia y los hallazgos clínicos. La enfermedad de Parkinson se ve diferente en todas las personas diagnosticadas. 4 síntomas principales: lentitud o bradicinesia, rigidez o rigidez, pérdida de equilibrio o inestabilidad postural, temblor o temblor en reposo. Esto quiere decir que cuando tu cuerpo no se está moviendo, usted está teniendo temblores. Para ser diagnosticado con la enfermedad de Parkinson, el individuo debe tener lentitud, más uno de los síntomas mencionados anteriormente. Los especialistas en el trastorno del movimiento se especializan en el diagnóstico y el tratamiento de enfermedad de Parkinson. Quiere decir que ellos van a examinarlos a cuanto los síntomas que se presenten.
In some instances, we do utilize something called a DaT scan to help confirm a diagnosis. And this is when there's a situation where the symptoms alone are just not quite enough to diagnose the disease on its own. Inevitably, Parkinson's can look like other neurological conditions. So the DaT scan is imaging technologies, a scan of the brain, which determines how much dopamine is available in a person's brain. And what you see here on this slide is the image of what a DaT scan can provide. So on the one side, we see normal imaging, and on the other, we see abnormal, right? So there's that very deep part of the midbrain that's showing really full dopamine, while on the other side, we can see there's much less, and it's asymmetrical, right? So there's a definitive depletion on that one side.
La otra manera de saber si la persona sufre de Parkinson disease es con un sistema de tecnología de imágenes que se le llama DaT Scan. Puede usarse para ayudar a confirmar un diagnóstico. No se puede utilizar para diagnosticar a la persona de Parkinson por sí solo. Esta tecnología de imágenes o escaneo del cerebro es para determinar cuánta dopamina está disponible en el cerebro de una persona. Como vemos en la imagen izquierda, el cerebro se encuentra normal. En la imagen derecha vamos a ver que se encuentra un poco anormal y encontramos que la imagen se ve un poquito menos como el de la normal. Quiere decir que el nivel de dopamina se está disminuyendo.
So approximately 60,000 Americans are diagnosed with Parkinson's disease each year.
Aproximadamente 60,000 estadounidenses son diagnosticados con la enfermedad de Parkinson cada año.
The incidence of Parkinson's disease increases with age, but an estimated 4% of people with Parkinson's are diagnosed before the age of 50. We sort of informally call this young onset Parkinson's, although the definition of young does vary in the literature. Right? So again, we know the incidence increases as a person gets older, and there are those who get diagnosed early or show symptoms much earlier in life. Next slide.
La incidencia de enfermedad de Parkinson aumenta con la edad, pero se estima que el 4% de las personas con Parkinson son diagnosticadas antes de los 50 años. Esto quiere decir, o lo consideramos, las personas jóvenes que le dan Parkinson, aunque a medida de años, las personas con edades le puede dar también Parkinson.
So how is Parkinson's treated? Officially, there's currently no cure for Parkinson's disease. So we yet to seek the antidote that can literally stop Parkinson's from progressing. However, there are several types of treatments available, and these treatments can help people to lead a very fulfilling life. I often say to my patients in the clinic, Parkinson's is manageable. Many symptoms can be relieved and managed by medications and other treatments, including surgery. So if the medications start to run out, or options in medications start to run out, or doses get to be higher, and people start to experience more and more side effects, surgery is there as an option. The overall goal is to reduce symptoms to allow optimal functioning, so a person can do all the things that they like to do. Complementary and alternative therapies are extremely important in managing Parkinson's. We can say equal to or possibly even more important than medication, and those include physical therapy, where a person works with a therapist to assist with gait and balance. Occupational therapy, and for this, a person would work with a therapist to assist with completing and doing all of their activities of daily life. Sometimes that also means relearning certain activities that we used to be able to do, but unfortunately can no longer do because of some of the deficits. And there's also speech-language pathology to assist with speech and swallowing, if perhaps the person has changes in their speech or has some changing with their ability to swallow. So again, these are the complementary therapies that are extremely important. I cannot stress this enough. Next slide, please.
¿Cómo se trata la enfermedad de Parkinson? Actualmente, lamentablemente, no existe una cura para la enfermedad de Parkinson, pero hay varios tipos diferentes de tratamiento disponibles que los diagnosticados pueden continuar llevando una vida plena. Muchos de los síntomas pueden ser aliviados y gestionados por los medicamentos y otros tratamientos médicos. Esto incluye la cirugía. El objetivo es reducir los síntomas para permitir un funcionamiento óptimo. También existen terapias complementarias y alternativas que es altamente sugerido por la doctora, como fisioterapia, para ayudar con la marcha y el equilibrio. Terapia ocupacional, para ayudar con actividades de la vida diaria. Patología del habla y el lenguaje, para ayudar con el habla y la deglución, quiere decir cuando tiene dificultades para tragar. Esta terapia se recomienda más que los medicamentos debido a que ayudan mucho para aliviar los síntomas.
So to go through motor symptoms in detail, we talked about resting tremor, which is the involuntary rhythmic muscle contracting leading to shaking. And this can be in one or more parts of the body. For some people, it could be literally a finger. For others, it could be a hand, the whole hand, possibly even one side where they may get shaking in their hand, in their foot. And it takes place when the muscle is relaxed, right? So at rest, not moving. For instance, when the hands are resting on one's lap, and it would usually disappear if perhaps the hand is now reaching over to grab a cup or to do something. Rigidity is the stiffness, like arms and legs can be stiff beyond what would result from normal aging or arthritis. Unfortunately, as we get older, many of us do get stiffer, and unless we are stretching and working on staying limber and flexible, it's actually quite easy for the body to naturally become stiff. With Parkinson's, it goes even beyond that. So it's stiffness to a much higher level. Bradykinesia, as I mentioned in the previous slide, is the slowness of movement. So movement can be slow on one side. It could be the hand, it could be the foot. It could be almost the whole body moving slower. Postural instability is defined as having imbalance. A person might be falling frequently. And freezing of gait is a very unique motor symptom present in Parkinson's, where a person might have these sudden, short and temporary episodes where they're not able to move their feet forward despite having the intention to walk. And it gives the feeling or the sensation that you are stuck, like literally stuck in place, like the feet are just stuck to the ground. And even though the body wants to propel forward, it can't. And another common motor symptom, though not everybody gets it, but some do, is the masked face expression, where there's a reduced degree of facial expression due to muscle stiffness. It's also called the poker face, where you can't quite read what the facial expression might be. If a person's happy, they might kind of give the impression of being sad or maybe angry, but you can't quite read the expression, the face expression. Next slide.
Los síntomas de motor en detalle. Temblor en reposo. Contracción muscular rítmica e involuntaria que provoca movimientos de agitación en una o más partes del cuerpo. Puede ser el dedo, todo el brazo, el pie, todos los pies, incluso todo el cuerpo. Se lleva a cabo cuando se relaja el músculo, por ejemplo, cuando las manos están descansando en el regazo. Quiere decir cuando tu mano o tus pies no se están moviendo y están en reposo y empiezas a tener temblores. Rigidez. Rigidez de brazo o pierna, más allá de lo que resultaría del envejecimiento normal o artritis. Bradicinesia, lentitud de movimiento. Inestabilidad postural, que es el desequilibrio, caídas frecuentes. También se encuentra el congelamiento de la marcha. Quiere decir que son episodios repentinos, breves y temporales de la incapacidad para mover los pies hacia adelante, a pesar de la intención de caminar, sintiéndose que está atascado. Quiere decir que cuando usted quiere moverse o caminar, no puede, como que algo lo está deteniendo. A pesar de que su cuerpo está tratando de caminar, se detiene. Pero también se encuentra la expresión facial enmascarada. Es el grado reducido de expresión facial debido a la rigidez muscular. Quiere decir que usted no sabría si la persona se está riendo, o está triste, o está enojada, debido a las enfermedades o los síntomas que produce la enfermedad de
And in front of us here, we have an image of a person. The masked face, right? No real expression. We cannot quite see it in this drawing, but there's the idea of the tremor, right? So the little squiggly lines by the hand. We see a stooped posture, and oftentimes connected with rigidity. A person might be really stooped forward and having a harder time keeping their shoulders back. Arms might sort of be stiff at the front, and there could be like a little bit of this bend of the knee, and the idea of shuffling, right, at the bottom of the drawing, right? So the feet are not lifting, right? When they walk, they tend to shuffle, they tend and quite often this can be audible. So you might actually be able to hear the feet dragging or scuffing along the floor.
En esta imagen podemos ver un ejemplo de alguien que está sufriendo la enfermedad de Parkinson. Aquí vemos el temblor que está ocurriendo enfrente de la cabeza. También vemos las facies con máscara, quiere decir, no sabemos si la persona está triste, feliz, no podemos reconocer las expresiones faciales. También vemos los brazos flexionados en codos y muñecas, no lo pueden estirar. Vemos los temblores que están pasando también en las piernas y vamos viendo los pasos cortos de arrastre. Usted puede oír la persona desde lejos arrastrando los pies. Eso quiere decir tiene la dificultad para caminar. También vemos las caderas y rodillas ligeramente flexionados. No lo puede poner recto o rígido. Vemos la espalda baja rígida, que no lo puede poner recto y no pueden ponerse de espalda. También vemos la postura encorvada, quiere decir que cuando están tratando de pararse rectamente, se le dificulta.
Non-motor symptoms in Parkinson's, there are quite a number of them listed here on the slide. So there can be anxiety and depression. It can be simply from having a diagnosis and dealing with the diagnosis and dealing with all the changing body symptoms. We also know that it is chemically related to the actual loss of dopamine in the brain, which is important for the entire chemical balance, including the cells that affect mood. Another frequent non-motor symptom, often present even way before tremors and slowness and stiffness, can be constipation. A person may also experience fatigue, loss of sense of smell. There can be some pain, and this is important to differentiate between arthritic pain or different unfortunate anatomical pains, the aches and body pains that we can experience from other purposes. But with Parkinson's, it's often described as a kind of a cramping, a sort of a discomfort. And we do know that that is also connected with loss of movement and rigidity. There may be cognitive changes. And with that, some kind of varying mild memory loss or word finding difficulty. A person may say, you know, I have the word at the tip of my tongue. I just can't find it. I just can't say it. There may be sleep disorders. So a person might not be sleeping as well or their usual hours. Their sleep cycle may have changed, or they may have REM sleep behavior where they're acting out their dreams and talking in their sleep. We mentioned speech therapists, right? So speech changes. The voice may become much quieter. It may be harder for a person to project their voice. And there can be swallowing difficulty. There might be some vision changes due to lack of blinking. The eyes may be blurry. A person could experience dizziness, and the dizziness can come from sort of issues related to the Parkinson's and also side effects from medications. And finally, on the bottom of the list, micrographia, which is handwriting changes. So a person might be experiencing abnormally small handwriting, or as they're writing sentences down the line, the words might get smaller and smaller and smaller. So that's another common non-motor symptom. And as was mentioned before, it's highly individualistic. So everyone has a different set of circumstances and experiences it differently. So a person may not get all of these symptoms, but they might get a good number of them. Next slide.
Los síntomas no motores de la enfermedad de Parkinson se encuentra ansiedad y depresión relacionado con la pérdida de dopamina, debido a que químicamente no está funcionando bien, y el estreñimiento. También se encuentra la fatiga, pérdida de olfato, dolor. Este es un poquito complicado debido a que puede ser dolores relacionados a la enfermedad de Parkinson o dolores relacionados a otro tipo de enfermedades o caídas o anatómicamente. Cambios cognitivos, pérdida de memoria, dificultad para encontrar palabras, trastornos del sueño o puede estar soñando y hablar o moviéndose. Cambios en el habla, voz más tranquila. Quiere decir que a medida que va hablando no se puede escuchar muy bien o va bajando más y más la voz. Dificultad para tragar. Cambios de visión, puede ser que se encuentre la visión borrosa o no puede ver muy bien. Mareo. Este síntoma puede también ser afectado por algún tipo de medicamento que se está tomando y puede ser también síntomas que se presentan. También se encuentra la micrografía, que es el cambio en la escritura a mano. Escritura normalmente pequeña o escritura que se vuelve progresivamente más pequeña. Quiere decir que a medida que la persona va escribiendo algo, al final de las palabras se encuentran más y más pequeñas. La enfermedad de Parkinson es muy individualista. Todos tenemos un conjunto diferente de circunstancias y lo experimentamos de manera diferente. Cada persona va a tener diferentes síntomas y no todos van a presentar los mismos síntomas que los demás.
And the medications to treat symptoms, so there are dopaminergic drugs. This imitates the action of dopamine when the levels are low. So kind of fooling or tricking the brain into thinking dopamine is available. And levodopa is the main therapy for motor symptoms in Parkinson's.
Medicamentos para tratar los síntomas de Parkinson. Fármacos dopaminérgicos para la enfermedad de Parkinson. Este imita las acciones de la dopamina cuando los niveles son bajos, engañando al cerebro para que piense que la dopamina está disponible. La levodopa sigue siendo la terapia principal para los síntomas motores de la enfermedad de Parkinson.
There are important facts about medications that I'd like to share with you here. Number one, it's important to recognize the generic name and the trade name. So quite often in the clinic, one provider may be referring to a medication by the trade name versus the generic name. This can be very confusing. So it's good to know both, and it's good to know the potential side effects of medications. It's also important to know the dosage that you are advised to take, how often to take the medication, and what exactly is the medication expected to do for you. So understanding the purpose of the medication and how it affects you will also help you to recognize the side effects if they are to appear. Next slide.
Datos importantes sobre los medicamentos. Es muy importante reconocer el nombre genérico, el nombre comercial y los posibles efectos secundarios de un medicamento. Esto quiere decir que si usted sabe el nombre genérico, el nombre comercial es muy importante debido a que muchos doctores se refieren al nombre comercial o al nombre genérico. También es importante saber la dosis que se recomienda tomar, la frecuencia con la que debe tomar el medicamento y lo que se espera que haga. Este propósito es para comprender el medicamento y cómo puede afectarlo. También lo ayudará a reconocer los efectos secundarios si aparecen.
And here on this slide begins the listing of the various medications for Parkinson's. So I don't want this to overwhelm anybody. It's mainly to know that there are quite a number, right? So we have levodopa, and then levodopa exists in various forms, right? So immediate release, control release, and you can see the different trade names. So there's Sinemet, Parcopa, Rytary, Duopa, Inbrija, and the side effects, right? Levodopa quite often as a side effect can give nausea, but not everybody gets it. And there are also ways to manage nausea and make it much less burdensome. So as always, it's good to speak with your provider about what would be the best dosage to take and the type of levodopa to take and what to possibly expect from it. So not going to go into detail on each and every medication for the sake of time. So if we can go to the next slide, and Tanya will hear your translation.
Ahorita mismo estamos en esta formulación diferente de levodopa. Esta imagen quiere darle la opción de que ustedes vean los nombres genéricos y nombre comercial que se encuentra. Levodopa es el medicamento principal, pero vemos que estamos teniendo diferentes tipos, como la liberación extendida, liberación de control. Y aquí vemos también el nombre comercial, que es Sinemet, Parcopa, Rytary, Duopa y Inbrija. Estos causan efectos secundarios como la náusea, pero sin embargo, no todos tienen estos síntomas y se puede controlar. Estos efectos secundarios no le va a pasar a todo el mundo y se puede manejar. Quiere decir que a pesar de que esté tomando estos medicamentos, se puede manejar y puede tener una vida regularmente, controlando los efectos secundarios que causa el medicamento levodopa.
Another medication option to go actually along with the levodopa is something called entacapone or Comtan. And most recently, we have a medication called Ongentys, also complementary with levodopa. And the side effects are similar, right? Because it is, whenever we have levodopa in the mix, we'll see similar side effects. Next slide.
Otras opciones de medicamento junto al levodopa está el entacapone o Comtan, está el opicapone o Ongentys. Estos efectos secundarios van a ser similar a la levodopa debido a que se encuentra presente. Y también podemos ver que pueden causar otros tipos de síntomas nuevos. Nuevamente, estos efectos secundarios se pueden manejar con medicamentos para poder disminuir los efectos secundarios.
Okay, again, for the sake of time, I'm not going to go through each and every one, but these are dopamine agonists. You can see the names of the medications here. Some of you might be familiar with pramipexole, ropinirole, rotigotine, and the various side effects that can occur. This really could be a separate webinar in and of itself. So just glance at the names and we'll go on to the next slide.
Medicamento agonista de la dopamina. No vamos a hablar en detalles, pero es para que vean los diferentes tipos de medicamentos que se encuentran presentes. También están los efectos secundarios. Esta presentación especialmente es para que ustedes vean los diferentes tipos de medicamentos presentes que se le puede ofrecer a alguien que está sufriendo de enfermedad de Parkinson.
And again, additional medications. So we really can't say that there are not any medication options for Parkinson's. There are quite a lot. So the list continues here: rasagiline, selegiline, safinamide, and you can just see a little bit of the, the trade name and then the possible side effects. Next slide, please.
Aquí vemos otros tipos de medicamentos, los inhibidores MAO-B, está la rasagiline, selegina, safinamida y los efectos secundarios. Quiere decir que hay demasiados medicamentos para la enfermedad de Parkinson y no podemos decir que no se encuentra ningún medicamento. Esta presentación es para que usted vea los tipos de medicamentos que se encuentran presentes.
And And same here, the NMDA antagonists, which are amantadine and the latest version, Gocovri, the extended release amantadine, and Osmolex, also the extended release amantadine. Next slide.
También encontramos en los medicamentos antagonistas de NMDA. Podemos ver aquí los nombres Gocovri, Osmolex, y aquí están los efectos secundarios.
And so surgical options, right? When a person's gone through lots of medications and they find that it's just not holding them enough. And statistically speaking, actually, people are going in for deep brain stimulation earlier these days, rather than perhaps waiting too long. So deep brain stimulation therapy is a surgical procedure which places a wire into a very specific part of the brain, the kind of deep midbrain area where electrical currents are delivered to these precise locations that are responsible for movement. And this regulates the abnormal brain cell activity that causes the motor symptoms. Again, this is not a cure. So in other words, by having this placed, it doesn't get rid of the Parkinson's. However, it does help to maintain and manage the symptoms. And from this image here, you can see, right? So we see kind of the region of the brain where the electrode goes. And then behind here, so behind the ear, under the skin, a wire is placed that leads down to the front of the chest. And there are two of these pulse generators that are basically used to help control that stimulation. And with the provider, so the patient works with the provider to have that specifically programmed to the correct frequency that best helps maintain the motor symptoms. So it's sort of like, instead of going to tweak medication dosages, the stimulation is thus tweaked instead with a programmer. Next slide.
Hay opciones quirúrgicas. Esto se ha presentado y muchas personas lo han obtenido mucho antes que después. Esto es la terapia de estimulación cerebral profunda. Es un procedimiento quirúrgico que coloca un cable en un área específico del cerebro, como vemos en la imagen. Envía corrientes eléctricas a ubicaciones cerebrales precisas responsables del movimiento. Regula la actividad anormal de las células cerebrales que causa síntomas motores. No es una cura, pero esto ayuda a que estimule el cerebro y no detiene la progresión. Ustedes aquí vemos en la imagen que se encuentra el cerebro, ponen el electrodo en la parte del cerebro donde está viendo. Entonces de ahí agarran una extensión y lo conectan con un neuroestimulador que es un generador de pulso. Con esto se envían pulsos al cerebro para que estimule y haga que el funcionamiento del cerebro se active.
The latest non-invasive surgical option is a technique that uses non-ionizing ultrasonic waves to heat or ablate tissue. It focuses beams of ultrasonic energy precisely on deep targets in the brain. And this has been FDA approved for essential tremor and also Parkinson's tremor. So here, just on the slide, you can see this little image. A person's going in, they have this cooling helmet on their brain, and they receive these very focused beams of energy. So this is rather different from what we just saw on the previous slide, where there's actual a surgical placement. And so this is the ultrasonic waves that are now used to treat this issue. Next slide, please.
Opciones quirúrgicas no invasivas. Una técnica terapéutica no invasiva que utiliza ondas ultrasónicas no ionizantes para calentar o estirpar tejido. Enfoca rayos de energía ultrasónica con precisión en objetivos profundos del cerebro, guiados por imágenes de resonancia magnética 3D. Esto ha sido aprobado por la FDA, que es la Administración de Alimentos y Medicamentos, para temblores esenciales y temblores de Parkinson. El año pasado se complementó la inscripción para el tratamiento de las complicaciones inducidas por la levodopa. Aquí en la imagen podemos ver que esta opción de terapia, de cirugía, es menos invasiva, solamente se le coloca algo arriba del cerebro y de ahí se estimula.
So now I'll discuss the importance of exercise in Parkinson's. Exercise increases the number of dopamine receptors in the brain. It increases blood flow to the brain and formation of new vessels to the brain. Exercise increases brain volume. It increases nerve growth factors that allow nerves to live longer. Also increases neuroplasticity, the ability for nerve cells to make new connections. And these benefits are universal. Exercise is important for everyone, not just those diagnosed with Parkinson's.
Importancia del ejercicio en la enfermedad de Parkinson. El ejercicio aumenta la cantidad de receptores de dopamina en el cerebro. El ejercicio también aumenta el flujo sanguíneo al cerebro y la formación de nuevos vasos al cerebro. También el ejercicio aumenta el aumento de volumen cerebral. El ejercicio también aumenta los factores de crecimiento nervioso que permiten que los nervios vivan mucho más tiempo. El ejercicio también aumenta la neuroplasticidad. Esto quiere decir que la capacidad de las células nerviosas para establecer nuevas conexiones. Estos beneficios son universales. El ejercicio es importante para todos, no solo para los diagnosticados con Parkinson.
General fitness is helpful for overcoming other age-related problems that can complicate PD or Parkinson's disease. So it can help overcome vestibular loss, neuropathy, spinal stenosis and lower back pain, arthritis, osteoporosis, and prior strokes. So we always emphasize the importance of exercise for everyone, not just individuals with Parkinson's.
El estado físico general es útil para superar otros problemas relacionados con la edad que pueden complicar la enfermedad de Parkinson. Esto puede ser la pérdida vestibular, balance, neuropatía, estenosis espinal y dolor lumbar, la parte de abajo de la espalda. El artritis, osteoporosis, accidentes cerebrovasculares previos. Esto quiere decir que el ejercicio no solamente ayuda con la enfermedad de Parkinson, pero para otros tipos de enfermedades que se encuentran presentes.
So I see a question in the chat about whether weight training or cardio is, I guess, better. And we will touch that in a later slide. But this also kind of emphasizes that even less vigorous activity can improve fall risk and just improves health in all areas. So walking is real exercise. Not all workouts are measured in sweat. So kind of any physical activity is extremely beneficial.
Vemos en el chat una pregunta acerca de qué tipo de ejercicio sería más beneficioso, si cardio o alzando pesa. Y aquí vemos que incluso una actividad menos vigorosa puede mejorar el riesgo de caídas, equilibrio y movilidad. Quiere decir que incluso caminar es un verdadero ejercicio. No todos los entrenamientos se miden en sudor.
And now I'll review the CDC recommendations for exercise for the general adult. So this touches both aerobic activities and muscle strengthening activities. For substantial health benefits, adults need to do at least 2 hours and 30 minutes each week of relatively moderate intensity aerobic activity, or 1 hour and 15 minutes each week of relatively vigorous intensity aerobic activity, or a mix of moderate and vigorous intensity aerobic activity. So aerobic activity should be performed for at least 10 minutes at a time, preferably spread throughout the week. And intensity is the level of effort required to do an activity. A person doing moderate intensity aerobic activity can talk but not sing during the activity. That's a kind of good way of judging. A person doing vigorous intensity activity cannot say more than a few words without pausing for a breath. And then it's also recommended to do muscle strengthening activities. Muscle strengthening should be done 2 or more days a week. All major muscle groups should be worked. These are the legs, hips, back, abdomen, chest, shoulders, and arms. Exercises for each muscle group should be repeated 8 to 12 times per set. As exercises become easier, increase the weight or do another set. And this is important for everyone, not just individuals diagnosed with Parkinson's.
Recomendaciones de los CDS para adultos. Actividades aeróbicas, actividades de fortalecimiento muscular. Actividades aeróbicas. Para obtener beneficios sustanciales para la salud, los adultos deben hacer al menos 2 horas y media o 150 minutos cada semana de actividad aeróbica de intensidad relativamente moderada. O 1 hora y 15 minutos o 75 minutos cada semana de actividad aeróbica de intensidad relativamente vigorosa. O una mezcla de actividad aeróbica de intensidad moderada y vigorosa. La actividad aeróbica debe realizarse durante al menos 10 minutos a la vez, preferiblemente repartidos a lo largo de la semana. La intensidad es el nivel de esfuerzo requerido para realizar una actividad. Una persona que realiza una actividad aeróbica de intensidad moderada puede hablar, pero no puede cantar durante la actividad. Una persona que realiza una actividad de gran intensidad no puede decir más que unas pocas palabras sin hacer una pausa para respirar. Actividades de fortalecimiento muscular. El fortalecimiento muscular debe realizarse 2 o más días a la semana. Debe trabajarse todos los grupos de músculos principales. Estos son las piernas, las caderas, la espalda, el abdomen, el pecho, los hombros y los brazos. Los ejercicios para cada grupo de músculos deben repetirse de 8 a 12 veces por serie. A medida que los ejercicios se vuelven más fáciles, aumente el peso o realice otra serie. Estas recomendaciones no solamente son para las personas que sufren la enfermedad de Parkinson, sino para todo el mundo.
So now just to address normal aging versus Parkinson's disease, how do I know if it's normal aging or a movement disorder like Parkinson's? Make sure to discuss and report all symptoms to your primary care provider, no matter what it is.
Envejecimiento normal versus la enfermedad de Parkinson. ¿Cómo sé si se trata de un envejecimiento normal o un trastorno del movimiento como el de Parkinson? Discutir e informar todos los síntomas a su doctor de atención primaria.
So if you're wondering if your stiffness and pain is associated with a movement disorder or just part of aging, pay attention to where the symptoms are located. If it's arthritis, it usually involves your hands, knee, or hip joints. For Parkinson's, stiffness and pain typically affects the muscles. So people with Parkinson's experience more muscle contractions, abnormal posture, inward turning of the foot, which are not really associated with arthritis. And they also experience vague sensations of numbness or tingling. So any of these symptoms, definitely report to your primary care provider.
Rigidez y dolor. Presta atención a la ubicación de los síntomas. La artritis generalmente afecta las articulaciones de la mano, la rodilla o la cadera. La enfermedad de Parkinson, la rigidez y el dolor suelen afectar los músculos, como las contracciones musculares, postura normal, giro del pie hacia adentro, sensaciones imprecisas de endurecimientos u hormigueo.
And then when considering whether cognition problems are kind of a quote normal part of aging or maybe something more, It's good to compare to your peers. So ask others who are the same age, similar health status, and physical fitness level what they are experiencing. Do others your age also occasionally misplace their glasses and forget the name of a film they recently watched? Neuropsychological testing can also determine whether cognition problems are normal due to age.
Problemas cognitivos. Compare con sus compañeros. Pregunte a otras personas que tienen la misma edad o estado de salud y nivel de condición física similares qué están experimentando. Otras personas de su edad también extravían ocasionalmente sus gafas y olvidan el nombre de una película que vieron recientemente. Las pruebas neuropsicológicas pueden determinar si los problemas cognitivos son normales debido a la edad.
So I want to leave time for questions. I'm just going to quickly breeze through the next two slides, but this is just a chart showing kind of normal memory loss associated with aging versus potential symptoms of dementia or a bigger cognition problem.
Esta presentación podemos ver la diferencia entre la pérdida de memoria normal y el síntoma de demencia. Aquí estamos los ejemplos y vemos que no es similar y tiene que acudir a su médico en cuanto usted presente algunos de estos síntomas.
And then when considering walking and balance, decreased speed is a normal part of aging. Look for other walking changes, such as shuffling of gait, which Natalie mentioned, dragging your feet as you walk, a reduced swinging of one arm while walking, freezing episodes where all of a sudden your feet just can't really move while you're walking. These symptoms are not normal signs of aging and must be reported to your primary care provider.
Caminar y equilibrio. La disminución de la velocidad es una parte normal del envejecimiento. Busque otros cambios al caminar, como arrastrar los pies mientras camina, como mencionó la doctora Natalie, reducir el balanceo de un brazo mientras camina, episodios de bloqueo o congelación de la marcha, quiere decir que usted se siente atascado y no puede moverse a pesar de querer moverse. Estos síntomas no son signos normales de envejecimiento. Tiene que informarle esto a su médico una vez.
So thank you so much for joining us today. We are so excited to be able to share this information. I do want to leave a couple of minutes for questions. I see someone in the chat did ask about how PSP is different and also how it is treated. That also can be a presentation in its own, but I'll let Natalie kind of jump in for a brief explanation.
Yes, definitely. So very good question. So PSP, so parasupranuclear palsy, it is a movement disorder. It does fall under the umbrella of movement disorder conditions that are treated alongside Parkinson's. And it actually, in early stages, PSP can look a lot like Parkinson's. So there's a whole lot of motor symptoms that are very much in common. One of the biggest factors that's different, and this is usually what clicks that diagnosis into place, is that with Parkinson's, eye movements are usually normal, right? So eye movements, when you move your eyes vertically, horizontally, but with PSP, it's not, that's actually impaired. And so PSP can quite often be diagnosed by a neuro-ophthalmologist doing a more in-depth eye exam. There are some treatments, including the alternative therapies like speech therapy and physical therapy, and some of the medications that cross over and can help PSP, but the trajectory inevitably becomes different. And so these two are different diseases, different conditions. So I hope I answered. That's it in a short summary.
Are there any other questions?
Hi, thank you so much for this. I'm extremely interested in finding out more about the ultrasonic wave therapy. There a particular website to go to, or I can just Google?
So I would start with the Parkinson's Foundation. If you go to parkinson.org, there's a ton of information. You can also call the helpline. And also, of course, contacting your neurologist or movement disorder specialist to explore that option as well.
Right. Do you know if it's insurance covered?
So for the FDA approved Parkinson's tremor, right, as it is FDA approved, that's usually the next step, right? Going into all the different insurance coverage. That also would be something that would be discussed if, let's say, a person is considered a candidate, they would check with the insurances and go forth. For the remainder of the focus ultrasounds that are still being studied, it is under like a clinical trial. So we have people that are going in for the focus ultrasounds. They had one part done. Eventually, they'll be going in for the second part. So there is a number of clinical trials that are still populating with that.
Thank you. Is it too late to participate in any of those?
So actually, this would be a good Dr. Sarva question. If you are interested in clinical trials, and again, this is like a completely different topic, which we can eventually dig into as a webinar. I would say, give us a call, and then we can connect you. I can speak with you a little bit more offline about this. We can connect you with our research coordinator.
Connect me with who?
Oh, our research coordinator.
Right.
Yeah, so let's get your contact information. If you'd like to write to us in the chat, or if you did sign up, I suppose, if we have your email address, or we can even give you perhaps let's give our clinic number. And if anybody wants to connect, you can reach me that way, Natalie. I'm here at the clinic.
Okay, and you're Dr.
So I'm Natalie, the nurse practitioner. I see patients,
you're Natalie. My
I
mother's
see
name was
patients
Natalie.
clinically, but I also work on the research trials as well.
Okay.
Like I said,
Thank
that's we can talk offline about that some more. So the clinic number, I can share this now, right, Abby? I think that might be the best universal bet. Those of you who are patients here already know this number very well. It's 212-746-2584.
Thank you, dear, so much.
Just to quickly go over a couple of the other questions. So there's a question about the wire for DBS and a question about diet. I would definitely go to parkinson.org to look more into this. There'll be a lot of information about DBS on there, and also on nutrition and Parkinson's. And then for more questions about PSP, which we didn't get to cover today too much, you can go to psp.org. That will also give you a lot of information. I'm so sorry that we're running out of time. We would have loved to kind of explore that further.
Oh, I see somebody wrote, does the wire remain in the brain for ... So the answer would be yes, forever, assuming that everything is fine and the device is going well and there's no infection. If it needs to be removed, it can be removed.
I also see we have a question or comment that says diet information. I'm not sure if that would be a whole other presentation. I think there might be too much to cover for that for right now. Yeah.
There's a lot of information on, it's actually parkinson.org with no S at the end.
Oh, sorry.
That's okay. And they do a ton of workshops and lectures too on nutrition and PD. I think they run one at least every month. So I would call the helpline and ask about joining one of those lectures.
Great. I think we are all out of time, unfortunately. But thank you all for your questions. I'm just going to pull up our poll if you want to answer any of them. It's optional, but we would really appreciate it. And yeah, any other questions, also feel free to reach out to my email address. I'll put it in the chat, and then we can connect you to any other resources as well. So feel free to reach out. And then I'll also be linking our YouTube channel if you would like to refer back to this presentation or share it with anybody else. It will be posted on there shortly. So thank you all so much. And I hope you have a wonderful rest of your day. Thank you, Abby and Natalie, for the super informative presentation and for answering all the questions.
Thank you for having us. Have a good day, everyone.